Welcome to another episode of the HealthCast. I'm super excited to have Jenni Gudapati on today, professor at Boise State and president and chief strategist at Healthy Insights. Welcome, Jenni.
Hey, thank you, Phil. Pleasure to be here.
Why don't we just jump right into it and start with your career background from you're a nurse at some point in your life and leading up to where you're at with business these days.
Perfect. Yeah. So, first off, I'll preface this. I think once you're a nurse, you're always a nurse. I keep
Yeah.
my nursing license active because I think that my career journey has truly all been inspired by my nursing background.
They're my
I have
favorite guests. Yeah, we just connect and there's a commonality to our vocabulary and to our approach.
absolutely, absolutely. And, I think back along my career and truly it had been such a serendipitous journey. I don't think when I got my nursing license, if I would have sat down and wrote down where I was going to lead, it would have ever looked like where I've had. I mean, I have been truly blessed where it seems every point in my career journey has stemmed to where I moved next. So much like you, Phil, I started as a critical care and emergency room nurse in the hospital. I lived in a little town called Geezer, Idaho. And so, got to work at kind of a smaller hospital, but then also got time working in a critical access hospital in my hometown for a little bit. And so, really stemmed this passion for rural health and just looking at the differences between access to care and quality to care and trying to maintain the rural feel of healthcare. And so what was the most interesting to me in my journey is working at the hospital is I started noticing the problems where the same patients would bounce back and forth into the
Mhm.
emergency room, right? We would see these same patients over and over and over again. And then very early in my career, I was lucky enough, I was appointed to the ethics board or committee of my hospital and got to sit in and, where I thought it was going to be so much STEM, like the sexy stuff we see on TV, we're making the life and death choices. What it really did was show that it was a lot about the financial concerns of the hospital, right? Like,
Ugh.
how can
Keeping the
we
door.
make the best decisions for our patients, if that makes sense. But then again, also coming back to there's this finance side, but then at the same side, why do we have these patients that keep bouncing back? And so I decided to leave the hospital and see if I could make a bigger difference more on the post acute care side of things. So I got into the field of home health. And what I learned once I left those safety net barriers of the hospital walls is we had no idea what our patients were going through once they left those doors into our health system. And it was really eye-opening to me because never had the trials and tribulations that our patients face. That wasn't taught to me in nursing school, at
Mhm.
least not to the extent of reality. And so I became pretty active in that, trying to make a difference in that post acute care space. I became president of the Idaho Association for Home Care and Hospice, and then was appointed by Bill Dombey to the National Association for Home Care and Hospice's Government Affairs Committee. And so I got the opportunity to travel to Washington, D.C. for several years and work with our federal legislators on really what does it mean for healthcare policy? How does that trickle down? And where does the rubber meet the road, right? Like, as you're looking at trying to create policy and regulation, what does that look like? I also became pretty active in the telehealth space. And so I became senior director of national accounts for a telehealth software company. And while in that role, I got to work a lot with payers and providers where, I would present things like case management strategy or remote patient monitoring and say like, I can take your hospital readmissions or unnecessary emergency room utilizations and really decrease that by implementing these programs. And I think one of the most eye-opening moments for me was I had a CMO look at me and he's like, Jenni, I love the fact that you live in the world of rainbows and butterflies. But if I truly take and cut out that much of our ER usage, our hospital readmissions, he goes, that's such a large portion of my revenue stream, I'd probably lose my job. And he's like, it's not that we don't want to incorporate these type of programs. We all want what's best for our patients, But until payment catches up and we move away from reimbursement that is only driven by sick care, heads in bed mentalities,
Yeah.
we're never going to be able to put those types of programs in place. And I think at that point in my time, not only during this career did I decide I had to learn the finance piece, I got my MBA,
Yeah.
but I saw that we needed to change healthcare payment at the national level. And we needed to look at things like population health management and value based care and decide that these are a lot more than buzzwords, right? Healthcare is the number one cause of bankruptcy in this country, with so many of them being seniors on traditional Medicare. And so I got the unique opportunity to come to Boise State University and create a master's degree program to really teach how can we do this. And so I left the big corporate job and, over the last 6 or 7 years now, got the basically the reins handed over to me and said, Jenni, if you can teach how to do this, let's do it. And so, at the time, we had Dr. Marlene Trump as our president, who's a very innovative leader. Dr. Tim Dunnigan was the dean for the College of Health Sciences. And they basically said, look, we want to be innovative. If you think you can do it, what do you suggest? And so, what was really cool is I heard Dr. Trump talking about how in higher education, they're having less and less students join or see like the ROI on getting a college degree, right? We're getting these students in, but they don't necessarily correlate to the job markets. And so in her presentation, she said, my hope one day is that we'll be able to partner with industry to create degree programs that are truly relevant in creating skill sets needed in industry. And so for me, that's all I needed for a green light. I called that very afternoon the Health Financial Management Association, HFMA, and said, I have an idea.
Is that
What
is that at the school, the university, or is that in DC? At this point, you have a lot of connections now to decision makers.
Absolutely. And, HFMA is truly the financial association, right? The revenue cycle, CFOs, and they're truly the experts in the finance side of
Yeah.
healthcare. And so
Okay.
with my nursing background, I'm like, I have the clinical background, I understand the care delivery, but what if we marry industry finance with clinical and create a master's degree to truly teach how can we transform healthcare? And what was so surprising is when I called HFMA and talked to them about this idea. They were like, all of our stakeholders are saying the same thing. We can't hire people that understand value based care or population health management. And so, believe it or not, within 24 hours, I had the green light from HFMA and said, let's do it. Let's create a program that teaches how to, what I like to term healthcare payment reform, right?
Like the Blues Brothers, you're on a mission from God to make this happen.
Absolutely, right? Like, can we do this? And
Yeah.
so we were all charged with it. And what was really cool with that is because there was never a partner degree program quite like this in the country, we really didn't have a roadmap. And so, on top of the fact that all of the faculty that teach in our master's degree program have real world jobs, right? Like, all of us are full time working in the field. But on top of our great faculty, one of the things that I knew is every single facet of the healthcare industry has to be involved in value based care, right? Silos have to be broken down. If the left hand doesn't know what the right hand is doing, we're never going to be able to coordinate for true cost containment strategy, for patient outcome driven strategy. And so, what we did is we created a curriculum that kind of walks through the patient journey from setting up patient populations, understanding risk profiles. This is more than diagnoses at this point, right? We know the impact of social drivers and health status and how patient populations look very different than what we used to think of in historical
Mhm.
context. And then how do we look at the finance of healthcare to be sustainable today where we're still primarily in, as much as I hate to say it, fee for service mentality? But how do we transition to patient outcome driven finance? What are the analytics we need to look at? And so we created this whole journey map. But what I really wanted to do is say, if we're going to create this, let's not reinvent the wheel. What if every single week during this journey and the topic that we're teaching, we reach out to the global experts and say, you teach our students what you think? And so over the course of the master's degree program, we've gotten over 80 of the top global healthcare experts to contribute to the curriculum, whether it be through PowerPoints, recorded guest lectures. And what we created was truly phenomenal. It was,
Sounds like
like I believe my lecture on, Medicare Advantage and things, it's taught by Sachin Jain, right? Like who other than Sachin Jain, CEO of Scan Health, should be teaching that class? We have Kimberly Brandt teaches a lecture on health policy and the making of the ACA. Kimberly Brandt is the administrator overall, CMS, and chief of staff. I mean, I'd have to
I
look.
yeah, no, that's okay. I'm following you.
Yeah, her and Stephanie are the big cheeses directly under Dr. Ernest. We have Ara, who's deputy administrator and CMMI. She gives a lecture on that. And then we have clinical leaders like Gordon Chen, who talked about why they formed Chen Med to be so different. And so when I talk about reaching out to the true leaders in healthcare and saying, are you willing to help? They all did. Out of the 80 people that I reached out to say, like, would you help me do this? No one said no. And
Yeah.
so I really think the understanding for the need to teach healthcare differently is there. I think the desire to transition to value-based and patient outcome care is there. And so all of these great leaders donated their time, right? At Boise State, we're a state institution. We didn't have the money to pay
Yeah.
all these people to do it.
Yeah.
They truly donated their time to the value of trying to change healthcare.
Your
Well,
message connected with them and then maybe their mission.
absolutely. And how inspirational, right? When you
Yeah.
hear these people that, I joke, most of them I stalked on LinkedIn. They like, I have this idea. I think we can change healthcare.
Yeah.
All immediately got on board, Phil. They were like, yes, let's do it.
I'm so glad you're here, Jenny. This is what this is all about. Like I was mentioning before, just that the world seems a little chaotic these days. But point of my podcast are to sit down with people who are making a difference in the world, and truly you are, and those that you're working with.
I hope, right? Like, I lost my father about 14 years ago, which is part of the reason my inspiration for value-based care is so high. I'm definitely a daddy's girl. He was such an important part of my life, and
Yes, ma'am.
he kind of got lost in the transition of uncoordinated care. And I'm like, if this can happen to my family and my father,
Yeah.
know for a fact this is happening everywhere. And so how can we get on the same page and truly look at coordinated healthcare, which is really what value-based care is. Excited about that journey. And to your point, are we changing things? What was interesting is when we created this degree, at first it was a nightmare to have no traditional faculty at all in a master's degree program. The amount of change that it did into higher education and accreditation bodies and getting through curriculum review processes. I mean, joke, Dr. John Buckwalter, he was our provost at the university at the time, just an absolutely wonderful man. I think he made me an associate professor in like 24 hours. Like we have all of these professionals. And so, at that point, they also said, well, Jenny, you can't really direct a master's degree program with a master's degree.
Yeah.
And while creating this program, decided, well, okay, I'm going to get a PhD.
Yeah. Just
And
on
I
the side, no big deal. Oh my
I
goodness.
PhD, but I want to get my PhD where I thought it mattered, right? So I had the clinical background of nursing. I have my MBA to understand the business side of things. But what I learned in my dealings and involvement with home health and looking at the great leaders, like I said, like Bill Dombey of this world, was policy and regulation is truly what changes healthcare. And so I decided to get my PhD in public policy and administration. And that has been just, so much learning for me, such a different
Mhm.
angle, kind of a harder journey, but
Mhm.
just so grateful for what I learned as I read about the books and how administration works and just how important it was for me to have that missing lens for healthcare transformation. And what was cool, Phil, is when we were putting together this program with all of this going on, this little tiny program at Boise State University, which, we create a lot of great nurses, respiratory care, but value-based care and healthcare administration was somewhat new to the university. A year after, we launched the program, CAMI, which is the Commission for Accreditation for Healthcare Management Education, they reached out and they're like, would you consider getting certified for Pop Health Management? This is the gold standard of education. And so we jumped at that opportunity to become a certified and then will soon be an accredited program with them. And then that first year, we won the Cami George and Regina Herzlinger Innovation in Education Award, right? So here
So
we won this national
so
award
cool.
within 2 years of launching the program. And then the following year, we won the Canon Solutions America Award for Sustainability in Healthcare Management Education, right? So
Yeah.
we truly feel we found this secret sauce to teach the next generation of healthcare leaders by healthcare leaders, learning from the historical precedents of the past. And it has been such an impactful and wonderful journey to be able to be on.
Wow. That's amazing. All of it, the whole journey. I don't want to go back too far, but you said a couple things that resonated with me. As a new nurse on my end, it was shocking to me. I think people underestimate, or I think lay people, people outside of people who don't visit the ER or have or working in the ER or a local hospital have any understanding of what's going on in their community. And then from that point, you added that emotion or that perspective is exponentiated with home health and
Mhm.
seeing what patients are really struggling with. So I think that perspective is critical. And then from there, you saw a need and you took actions. Good for you, Jenny. That's an amazing story.
Well, thank you. Thank you. I mean, I'm so grateful. And like I said, I just feel like my career has just been blessed. So, like, there has been somebody guiding this journey because to look at all the different things that play into patient well being and patient journeys and patient outcomes, had I not given just this wide lens, I don't think I would look at healthcare the same. I mean, I'll talk about a patient that probably can say it best. We had a patient that was bouncing back and forth into the emergency room.
Yeah.
And, he would come in with diabetic ketoacidosis, right?
Mhm.
And we'd be like, why aren't you taking your insulin? He's like, I'm taking it. I'm taking it. And in the hospital, we're like, yeah, sure, you're taking it, right? Like, if you were taking your insulin, But what was interesting is he was one of the first patients I got to admit when I got into the home health world. And when I got to his home, what I realized, his refrigerator was bad.
Mm,
So if you think about it, you keep the insulin in the
yeah.
refrigerator.
Yeah.
The connection was never there, right?
Yes.
Thought he was
That's
following,
really interesting detective work.
right? And so it completely changed the idea that, there's so much to the story that we don't think about. Or I've taken care of patients that, they had food insecurity. And so sometimes coming to the emergency room was the meal that they got for the day. Changes the lens that you look through when you go into a patient's home and you see things from their perspective. And I think that's what, as we look at patient-centered outcome and patient-driven care, is that patient perspective, patient-based learning, all of that is going to be so impactful as we look at how do we finance healthcare to truly make a difference.
Yeah. It upsets me when I feel like I have to practice, I call it fast food medicine. And you took the time to go deeper. And what I also hear is how I like to practice is I like to prioritize the individual. I like to hear, that allot them the time needed and, in an efficient way and to take it. And that's what you did. You went to the next step.
It is what all home health nurses across the country, like, in my opinion, home health and hospice nurses, they need to be put on a pedestal. I mean, those individuals probably work harder than anybody I know, and they never know what they're going to see every
Yeah.
day. They never know what they're going to walk into, and they're truly kind of like they're unsung
Unsung heroes? Yeah,
heroes.
yeah. I've been thinking a lot about that, even though I've been in medicine and emergency medicine, I've been just thinking more just through these conversations that about EMS, and I live, near a treacherous highway that is notorious for accidents. There's multiple deaths a year, blah, 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 in the mountains, and EMS, I think, is unappreciated, and I would add to that, like, from our conversation, home health. Appreciated warriors making a difference.
Yeah.
Yeah.
I mean,
What
I EMS were there in all of the really cool TV shows,
Yeah,
right? Nobody's gonna sit down every Friday night and watch the journey. home health or hospice nurse.
Oh, sure. Yeah. Well, yeah, that's funny. That's funny. Well, yeah, and the reality that we all know is, that those TV shows don't always mimic real life. And
Yes.
what what does an average day look like for you, or maybe an average week look like for you these days with your at Boise State and with Healthy Insights?
So now, after I got the program up and running, having success, I was able to step back a little bit to part-time. So, I still kind of direct and lead the program, still teach. In fact, I teach the capstone project where, I ask our students, they all have to come up with their own alternative healthcare delivery model, what that would look like for payment structure, what are the barriers and regulations? Are there CMMI models that are like what they're proposing, not like? What are the analytics? And so in order to do that, you really needed to understand the entire synthesis of everything that they learned during those 5 semesters. So I get the privilege to teach the capstone and help the students, create those alternative payment models. And I tell you what, the students have been doing some pretty fantastic work. So that is kind of like my part-time job. But then my full-time job is I developed an idea and started a health tech company. And again, so much of it came out of the lessons learned from creating our master's degree program, as well as my near 3 decade, nursing career. Really, what I do now is I meet with potential customers and explain how the Healthy Insights platform can help be successful in these new alternative payment models, Medicare Advantage especially. So, kind of,
Just
yeah.
sorry, pardon me, just to interject and just to clarify. So you're the founder of Healthy Insights, as well as now currently the president and chief strategy officer. Super cool.
So I'm the founder. I have several partners that, obviously I couldn't do this journey without them
Yeah.
because, as a nurse, I have the ideas behind it, but
Yeah.
my husband will tell you Jenny has a hard time running the remote control. So as far as building a tech platform and
Yeah.
things like that, I have incredible partners. I was blessed to meet our CEO, Adam Korn, who is an executive, history. He's been at United Healthcare, CVS. He's done some time in the Blues. And so when him and I met, I had already had the idea of Healthy Insights, and he was able to partner me with, this new company to really build it. And over the last several years, as I was building the master's degree, and like I said, I gave all of these experts basically an open mic. They would be like, what do you want me to teach the students? And,
Mhm.
so I think I know a lot about healthcare, but I don't know everything. And so if I am getting these experts in to teach the students, I wanted them to tell the students, this is what I think are the most important things. These are the things that I think your students need to learn. And what I heard over and over and over again were the same things, right? Data interoperability is a problem, patient information silos are a problem. And so, to take it back at its core, what we know, like in Medicare Advantage and value-based care, risk-based contracting, is so much of what I like to say, the resources that are made available for patient care, right? Everybody will say it's their PMPM or, what the RAF score is, for the foundational thing. It's so important. And the thought behind a risk-based contract is we're supposed to identify patient risk, and then based off of that perceived risk, they're given a score which correlates to an amount of money, typically a per member per month fee, which is supposed to pay for the care for that patient, right? So that we can try and look at cost containment strategy, promoting best patient outcomes. But what happened is the thought process is correct, right? We know that there are certain people that need a lot more resources than others. And so what kind of happened is it became this, upcoding game. Well, if we can code these patients X, Y, and Z, this is how much money we're going to make. And it didn't really correlate at all to patient outcomes. We have things like
Mhm.
MIP scores or quality scores, but not in effect where it truly tied to cost containment from a meaningful way for providers, in my opinion. And so what I would hear is I would hear the payers or the insurance companies, they would teach the students about how important identifying patient risk was so that they could mitigate it, right? And we all know that annual wellness visits and proper screening is imperative for identifying risk and being able to properly care plan to try and, work through our strategy and care planning. But then at the same token, I would have provider groups or providers teach like, we get that, but annual wellness visits take so long to do. It can take up to 45 minutes. The patient comes in, we have to ask all these questions. Instead of having a meaningful patient visit, it ends up just being a data collection, right?
Yeah.
And then so many times they didn't even communicate with each other, right? The risk score didn't even match up with the provider care planning because in so many of those contracts, the physician is still reimbursed at a fee for service. The risk score doesn't really affect how the provider gets reimbursed. And so, as I heard these struggles of workforce burden and not enough MA staff and physician clinics, I was thinking like, well, what if we came up with a solution to do that? What if I could create a platform that the patient could do ahead of time in which it met the requirements of an HRA for health plans, but then at the same time provided the foundation for the annual wellness visit so that all of that screening, everything that they needed for a successful annual wellness visit was done beforehand. And what if also on that, we add into it things like cognitive screening, because less than 8% of seniors right now in the US are getting screened for cognitive impairment. And we know that in many instances, that's up to 60% of the lost cost for payers is undiagnosed cognitive impairment. And the reason for it is it's not where a lot of providers are trained, especially
Mhm.
in rural areas. And so what if, we could do this effective screening, provide guides, but then at the same token, provide a report for providers ahead of time with like frailty indicator scores, all of the social driver and social needs and determinants already identified and give it to them in a clean reporting structure that can be integrated into their care plan and make it simple, but have the data go to both payers and providers so
Yeah.
that there's coordinated care. There's congruent documentation, right? It's not this
Yeah.
chart
Yeah.
chasing. And more importantly, it's not chart scrubbing for codes, right? This is a
Yeah.
patient directed, patient centered technology where it puts the patient and caregivers in control, and 100% of the information is effectively supplied by the patient in the comfort of their home on a mobile app. And so we created a platform to do that. We're thinking it's saving about 45 minutes per patient for annual wellness visits, reducing that workforce administration. And then as the MAs get under fire for, non-encountered chart codes or, this chart scrubbing techniques and, utilizing AI to
Mhm.
try and find that. This is really, in my opinion, a platform to create the true patient story, the patient true health reflection. And I think it stemmed from my years in home health, right? Where you know that when the patient is in their home and they're comfortable, they're going to be able to answer these questions honestly or with the assistance of a caregiver. And it's not under the gun at an office
Yeah.
where they, like I should probably say this, right?
Yeah.
So
Right. I've heard that response. Yeah. Can I ask you, I'm completely following you. Can I ask you for the layperson who doesn't speak healthcare like you and I to summarize Healthy Insights mission in a few sentences?
yeah, so the mission of Healthy Insights is truly to bridge the gap in disconnection between payers, providers, and patients, right? At
Got
the
it.
forefront, it's bridging that gap and understanding that if we're going to be successful in value based care, it has to be an informed care team working together with aligned incentives, better outcomes. That's 100% driven by the patient story.
Yeah. When was Healthy Insights formed?
About a year ago. I mean, off and on. I mean, in my brain, it's been over the last several years, but Healthy Insights as a company was just formed over the last several months.
Since launch, how have things been going?
Things have really pretty great. I mean, the response that we're getting for the company has been phenomenal. I tell you, like when when I present to payers or providers alike about it, the thing that is funny is they're all like, "Oh my God, that's just so much common sense."
Yeah.
I like it's just the common sense platform to bridge that gap. And so there's value to all stakeholders, right? Number one, for the patient, so that when they go to the clinic, it's a meaningful, hopefully face-to-face visit with their provider,
Mm.
because all that information and time where they're normally in front of the computer,
Yes.
that's done ahead of time. And so that visit, that annual wellness visit, can actually be care planning and face-to-face interaction with the payer and provider, or the
Connection.
patient provider, I should say. But then by giving that data also to the plans, they can allocate appropriate resources based off of those codes if they need things like transportation issues, or if they've seen that there are social drivers that could impact, the quality of the journey for the patients. And it keeps it in a collected environment where we're all looking at the same thing and hopefully working together to produce those patient outcomes.
What maybe in a tangible way, what does winning look like for Healthy Insights? How's the future look? I'm gonna put those together.
Well, in my opinion, the future for Healthy Insights looks like it's recognized as a neutral healthcare, neutral risk screening platform, right? We don't get paid more if the patient gets a higher risk score or a low risk score. What I would like is it is a neutral patient risk assessment that shows the true reflection of the patient's health and social case status. And I would like it to be seen in the best future as an apples to apples comparison across all the patients, right? This is just truly something that can be used to guide so that risk identification for patients is actually meaningful and gives care considerations for physicians to be able to actually act on the risks that are identified for the patient population.
Well, thank you so much, Jenny. I think your work is amazing, and thank you so much for spending some time with us today and sharing your career journey and sharing some insight on Healthy Insights. I really appreciate it. Thank you for joining us for another episode of the HealthCast. Stay tuned for more. Appreciate it.